Welcome to Workplace Violence Prevention Training. This training is designed for clinical, non-clinical, and administrative staff and focuses on recognizing, preventing, and responding to workplace violence. Every employee plays a role in maintaining a safe work environment and meeting California workplace violence prevention requirements. Learning objectives. By the end of this session, you will know what workplace violence means under Senate Bill 553. The 4 types of workplace violence. How violence occurs in healthcare and administrative settings. Prevention and de-escalation. How to report concerns or incidents. How incidents are logged and investigated. And lastly, what's in our WVPP and where to find it. What is workplace violence? Workplace violence is any act or threat of physical violence, harassment, intimidation, or other threatening behavior that occurs at the work site. It ranges from threats and verbal abuse to physical assaults and even homicide. It can affect and involve employees, clients, customers, and visitors. Workplace violence remains a significant occupational safety concern nationwide. According to the most recently available statistics from the Bureau of Labor Statistics census of fatal occupational injuries, violent acts were the 3rd leading cause of fatal occupational injuries in the United States. In 2023, of the 5,283 fatal workplace injuries reported, 740 fatalities resulted from violent acts. Homicides accounted for 458 of these deaths, representing 61.9% of all violent workplace fatalities and 8.7% of total work-related deaths. Regardless of how it manifests, workplace violence poses a substantial risk to both employers and employees and requires proactive prevention, reporting, and response. Understanding the 4 types of workplace violence. Workplace violence is not a single behavior or isolated event. It presents in multiple forms, each with distinct risk factors, warning signs, and response requirements. Under California law and our Workplace Violence Prevention Plan, employees must be able to recognize, report, and respond to all types of workplace violence. Understanding these categories allows for earlier intervention, safer responses, and effective prevention, which is essential to protecting our workforce and maintaining compliance with SB 553 and Cal/OSHA requirements. Now, let's review the 4 types of workplace violence. Type 1 violence is workplace violence that is committed by a person who has no legitimate business at the worksite and includes violent acts by anyone who enters the workplace or approaches workers with the intent to commit a crime. For example, a person with no connection to the business enters the workplace to steal property, threaten employees, or instigate a physical fight. Type 2 violence is directed at employees by clients, customers, patients, externs, and visitors. For example, an agitated patient in pain, or a family member angry about delays. Type 3 violence is workplace violence against an employee by a present or former employee, supervisor, or manager. For example, a coworker, supervisor, or former employee threatens, intimidates, harasses, or attempts to start a physical fight with an employee over a work-related or personal dispute. Type 4 violence is workplace violence that is committed in the workplace by a person who does not work there but has or is known to have had a personal relationship with an employee. For example, a current or former partner, family member, or acquaintance comes to the workplace to threaten, harass, or attempt to start a physical fight with an employee. Workplace violence in healthcare, California risk overview. Healthcare accounts for approximately 25% of all workplace violence incidents, placing it among the highest risk industries in California. Risk is not limited to clinical care areas. Administrative and non-clinical settings such as front desks, billing offices, and scheduling departments face significant exposure due to payment disputes, access delays, unresolved complaints, and perceived lack of authority. Incidents most often involve patients, family members, or visitors and commonly escalate during emotionally charged situations or service disruptions. Typical escalation follows a predictable pattern: raised voices, harassment, threats, and aggressive behavior, with warning signs including hostile language, refusal to comply with direction, pacing, clenched fists, and fixation on a grievance or individual. Early recognition and response are critical to preventing escalation and ensuring staff safety across all roles and settings. Prevention: de-escalating conflict and preventing volatile situations. Workplace violence prevention, proactive risk reduction. Workplace violence is predictable, preventable, and a recognized occupational hazard in healthcare and administrative environments. Effective prevention requires early identification, consistent response, and clear accountability at every level. Prevention strategies. Identify early warning signs such as agitation, raised voice, pacing, refusal to comply, or fixation on grievances. Communicate clearly and consistently. Apply policies and boundaries uniformly. Minimize environmental stressors when possible, including long wait times, overcrowding, noise, and lack of privacy. Understand escalation pathways and involve supervisors, security, or emergency services when risk increases. Report concerns promptly, even when no physical violence has occurred. De-escalation, safety-first response expectations. De-escalation is a core safety competency, not conflict resolution. The objective is to reduce emotional intensity, maintain control of the environment, and disengage safely. Types of de-escalation tactics. Remain calm, professional, and respectful at all times. Use clear, simple language. Listen actively and acknowledge concerns without validating inappropriate behavior. Maintain appropriate physical distance and ensure access to exits. Set firm, respectful boundaries and redirect behavior as needed. Disengage and seek assistance immediately if behavior continues to escalate. Remember, do not argue, raise your voice, or take aggressive behavior personally. Attempt physical intervention unless trained, authorized, and required. Reporting and response. Reporting workplace violence concerns or incidents. In accordance with California Labor Code 6401.9, employees are required to promptly report all workplace violence concerns, threats, or incidents, including verbal aggression or unsafe behavior, regardless of whether an injury occurs. Retaliation for reporting is prohibited. What should be reported? Threats, harassment, or aggressive behavior. Physical assaults or attempted assaults. Escalating behavior or warning signs. Concerns about security gaps or unsafe conditions. How to report concerns. Via email to your direct supervisor manager or, if unavailable, the next level of management. By calling your direct supervisor manager or, if unavailable, the next level of management. In-person meetings with your direct supervisor manager or, if unavailable, the next level of management. Use of the company's communication devices, apps, chat features, or similar methods to contact your direct supervisor manager. And lastly, during annual WVPP meetings or any special meetings. Violent Incident Report. In the event of a workplace violence incident, employees must promptly notify their supervisor. If the supervisor is unavailable, the report must be escalated to the next level of management or BAS Human Resources. Incidents involving an employee and a patient must also be reported to BAS OSHA compliance. A workplace violence incident report is required within 24 hours and is used for regulatory documentation and trend analysis. Reporting supports a culture of safety and is protected from retaliation. If the incident involves the employee's direct supervisor, BAS Human Resources will manage the reporting process. Post-incident response. Following submission of a workplace violence incident report, BAS Human Resources and OSHA compliance will promptly initiate an investigation, with a target completion timeframe of 7 calendar days. All investigations must be documented using the approved incident report form. The investigation process may include a timely visit to the incident location and must document at a minimum date, time, and location of the incident. Type of workplace violence. Detailed description of the incident. Classification of the perpetrator. For example, patient, visitor, family member, coworker, supervisor, or an individual with criminal intent. Circumstances at the time of the incident, including job duties, staffing levels, lighting, isolation, ability to obtain assistance, or work setting. Location category, for example, workplace, parking area, or off-site location. Violence incident log completion. Following a workplace violence incident, BAS Human Resources or OSHA compliance will complete a violence incident log for each reported occurrence. The log will be finalized within 7 calendar days of the incident. The log will be compiled using information obtained from affected employees, witness statements, and investigative findings. To protect confidentiality, all personally identifying information, except for the name of the individual completing the log, will be excluded. This includes names, addresses, email addresses, phone numbers, social security numbers, and any other information that could reasonably identify individuals involved in the incident. The plan. Workplace Violence Prevention Plan. The Workplace Violence Prevention Plan establishes an organization-wide framework to prevent, respond to, and mitigate workplace violence risks in compliance with California SB 553. The WVPP is reviewed annually, and whenever a workplace violence incident identifies deficiencies in the plan, any updates or revisions are communicated to employees to ensure continued awareness and compliance. WVPP goals: prevent workplace violence through early identification and risk reduction. Protect employees, patients, visitors, and contractors from harm. Ensure consistent reporting, response, and investigation of incidents. Identify trends and high-risk conditions to support continuous improvement. Maintain full compliance with Cal/OSHA and SB 553 requirements. Workplace violence prevention is a legal obligation and operational priority, not a discretionary practice. Roles and responsibilities under the WVPP. Workplace violence prevention requires clear accountability across all levels of the organization. Employer responsibilities include develop, implement, and maintain a written WVPP. Provide required training and resources. Investigate incidents and maintain required records. Implement corrective actions and preventive controls. Ensure employees are informed of investigation outcomes and implemented corrective actions as appropriate. Management and supervisor responsibilities. Enforce WVPP procedures consistently. Respond promptly to reported concerns and incidents. Support investigations and corrective actions. Communicate investigation results and corrective actions to affected employees. As appropriate, ensure employees understand reporting expectations. Employee responsibilities. Follow WVPP procedures and safety protocols. Report workplace violence concerns or incidents promptly. Participate in training and prevention efforts. Employee involvement and training requirements. Active employee participation is a core requirement of SB 553 and essential to effective prevention. Employee involvement. Employees are encouraged to report hazards, concerns, and incidents without fear of retaliation. Feedback from employees is used to identify trends and improve prevention measures. Participation in investigations and safety discussions supports risk reduction. Training requirements. Initial and ongoing workplace violence prevention training is required. Training includes recognition of warning signs, de-escalation strategies, reporting procedures, and response expectations. Training must be documented and tracked in accordance with regulatory requirements. Workplace violence prevention training is mandatory, ongoing, and subject to audit under SB 553. Accessing the Workplace Violence Prevention Plan. The Workplace Violence Prevention Plan is a required Cal/OSHA and SB 553 document and must be accessible to all employees. Employees may access the WVPP through the BAS Facility Safety Manual, the BAS intranet, or by requesting a copy from management, BAS Human Resources, or OSHA compliance. Employees are expected to know where the WVPP is located, understand their reporting, response, and safety responsibilities, and refer to the plan whenever workplace violence concerns or incidents arise. Employee record access rights. Employees and their authorized representatives have the right to request and receive access, within 15 calendar days, to workplace violence-related records at no cost for examination and copying. This includes records related to workplace violence hazard identification, evaluation, and correction, workplace violence prevention training records, and violent incident logs, with all personal identifying information redacted. Compliance reminder. Access to the WVPP and related records is a legal requirement under California SB 553 and supports transparency, accountability, and active employee participation in workplace violence prevention. Key takeaways and reporting guidance. Key takeaways. Workplace violence is predictable, preventable, and a recognized occupational hazard. Early recognition, de-escalation, and timely reporting are critical. Reporting concerns is mandatory and protected from retaliation. All incidents are documented, investigated, and reviewed under SB 553. How to report a concern or incident. Notify your supervisor or manager immediately. If unavailable, contact BASS Human Resources or OSHA Compliance. For imminent danger, contact security or emergency services. BASS Compliance contacts. BASS Human Resources, hr@bassmedicalgroup.com. BASS OSHA Compliance. OSHA Compliance at bassmedicalgroup.com or call 925-658-3533. Thank you for your participation.